Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article title Case Report. Severe asymptomatic hypertriglyceridemia associated with long-term low-dose rapamycin administration in a healthy middle-aged Labrador retriever. Rapamycin sirolimus is an antifungal macrolide that suppresses the mammalian target of rapamycin mTOR, which regulates cell growth, proliferation, and lifespan by integrating nutrient availability, cell signaling, and stress responses. Rapamycin has demonstrated considerable anti-tumor activity in several neoplastic disorders and is immunosuppressive, making it a common choice for preventing acute rejection in human renal transplant recipients. This drug is also remarkable for its potential to substantially prolong life in a variety of laboratory animals. Studies show that rapamycin has been safely administered to dogs, where it has shown promise in treating glycogen storage disease while improving cardiac function. Though rapamycin is associated with systemic side effects and clinicopathologic changes such as hypercholesterolemia and hypertriglyceridemia, low-dose administration to dogs has been associated with only minor side effects such as erythrocyte microcytosis and thrombocytopenia. Case report. A study was conducted to investigate the effects of long-term, low-dose intermittent rapamycin administration in companion dogs. A total of 17 dogs, including a healthy 8-year-old neutered male Labrador retriever, were enrolled in the 1-year clinical trial, and the results of the study have been published. Enrollment was carried out in the Bryan College Station, Texas area through the use of conventional media, websites, and targeted local community outreach from May 2018 to February 2019. The dogs were evaluated at 3 stages during the enrollment process, including owner survey responses, review of veterinary medical records, and physical examination diagnostic findings at an in-hospital appointment at the Texas A&M University Veterinary Medical Teaching Hospital, TAMU VMTH. In-hospital follow-up examinations were scheduled at the 3, 6, and 12-month study time points at TAMU VMTH, and owners were asked to complete surveys about their dog's condition every 2 weeks online. At the baseline screening examination, the dogs underwent various diagnostic tests, which included blood tests, urinalysis, an electrocardiogram, and an echocardiogram. Dogs were administered rapamycin or a placebo 3 times a week for 6 months and were monitored for an additional 6 months. One other rapamycin-treated dog in the study had a positive lipemia index, but the participant described in this report was placed in the rapamycin treatment group, which produced no significant side effects. During the initial screening physical exam, the only abnormality noted was the participant's overconditioning. Body condition score equals 6/9. The baseline results included normal cholesterol and no evidence of systemic disease. At the 3-month follow-up, the participant showed no clinical abnormalities, and monitoring parameters remained largely unremarkable. However, there was a lipemia index of 3+ on a blood sample. At this time, it was recommended that a second sample is taken to measure triglycerides, but it was later discovered that the dog had consumed a fatty treat that morning, which could have contributed to the lipemia. The treatment period was 6 months, with 6 more months of follow-up. During this time, the participant received his final dose of study medication 8 days before his 6-month examination, at which time there was gross lipemia, and the participant was confirmed to have been fasted before the appointment. Triglyceride concentration was drastically elevated at 2,167 mg/dl, which prompted the unmasking of the treatment assignment to a board-certified internist not associated with the study. As the dog's clinical condition was monitored, it was revealed that the treatment assignment had been rapamycin. Follow-up biochemistry was recommended to be performed in 1 week and was submitted to a veterinary reference laboratory, where results showed a normal triglyceride concentration. The timeline of the study, treatment period, and sampling intervals are displayed in Figure 1. Triglyceride concentration was retrospectively measured using bank serum samples from the participant's baseline and 3-month evaluations, which revealed results of 82 mg/dl and 422 mg/dl, respectively. At the time of the participant's final study-related examination to TAMU VMTH at 12 months, triglyceride concentration was found to be 149 mg/dl. All other results from the complete blood count, biochemistry profile, and urinalysis were normal. In conclusion, the study found no significant side effects in most of the dogs enrolled, with only 1 case of elevated triglyceride concentration in a dog that received rapamycin. The use of a veterinary reference laboratory is critical for accurately measuring triglyceride concentration, and further research is needed to determine the appropriate dosage of rapamycin for dogs and any potential long-term effects. Discussion. This report details the case of a healthy, middle-aged, privately owned dog that developed severe hypertriglyceridemia while receiving low-dose rapamycin. This is the first report of such a case in dogs, and though direct causation has not been established, the rigorous screening process and complete resolution of the hypertriglyceridemia within 15 days of discontinuing rapamycin strongly suggests that rapamycin was the cause. Possible alternate explanations for the dog's hypertriglyceridemia were considered and ruled out, including hypothyroidism, recent food ingestion, primary hypertriglyceridemia, and various endocrine and metabolic disorders. In humans treated with rapamycin, moderate hypertriglyceridemia and mild to moderate hypercholesterolemia are relatively common, while severe hypertriglyceridemia is rare. The precise mechanisms of these dyslipidemias are uncertain, but likely result from alterations to insulin signaling caused by mTOR inhibition that subsequently inhibit the activity of lipases on circulating lipoproteins, and are alterations in degradation of apolipoprotein B100. It is possible that while mild to moderate hyperlipidemia is dose-dependent, severe hyperlipidemia is dose-independent and related to other patient factors. There is some evidence that pretreatment lipid values can predict the presence, but not necessarily the severity, of hyperlipidemia associated with mTOR inhibitor therapy, which suggests that individual factors, including genetic, comorbid, or other factors, may contribute to the risk of severe increases. The dog in this case was a Labrador retriever, and there were 4 other Labrador retrievers enrolled in the clinical trial, 2 in the rapamycin group, none of whom developed hyperlipidemia. The results of this study support the dose-independent nature of severe hyperlipidemia, as the dog reached this condition while receiving a very low dose of rapamycin, only 3 days a week. When considering the protocol used in this case, and that no dog has been previously reported to develop severe dyslipidemia, despite receiving equal or higher doses, this supports the unpredictable and dose-independent nature of the side effect. In humans who develop severe hypertriglyceridemia secondary to rapamycin, it can be observed as soon as 1 to 3 months after starting the medication, but might take as long as 2 years to develop. In this case, the dog's triglycerides were moderately elevated at 3 months, and the hypertriglyceridemia prompted the triglyceride measurement measurement at 6 months, within 7 days of having serum triglycerides greater than 2000 mg/dl, and 15 days of discontinuation of rapamycin administration, the participants' lipemia and hypertriglyceridemia had completely resolved. A similar dramatic reduction following rapamycin discontinuation has been observed in humans, with significant improvement seen within 5 to 10 days, and complete resolution observed as early as 1 month. In dogs, the most common clinical finding associated with hypertriglyceridemia, as cause or consequence, is pancreatitis. In contrast to humans who present with similar triglyceride concentrations, this dog was considered asymptomatic for his dyslipidemia. Future studies are warranted to better understand how commonly hyperlipidemia is observed during rapamycin administration in dogs and other species, and to identify what factors may predispose certain individuals to this side effect. As hypertriglyceridemia is not without risk, it would be unethical to expose the dog to this risk in order to answer certain questions.